Hi, everybody. Thank you so much for joining us. This is one of those another emergency frontline broadcasts where, given circumstances that we are seeing on the ground in real time in communities across Massachusetts, we wanted to bring you some additional information and some critical information about what's taking place in Brockton from some leading community activists and advocates and public servants that are seeing the impact of the coronavirus, COVID-19, have a devastating effect across communities, particularly now in Brockton. The latest numbers that I have, and City Councilor Rita Mendez might be able to share some updated figures here, but as of from Friday morning, late Thursday night, up through this weekend, 28 additional people passed away in Brockton alone. It's about 70 people passed in total, so about a third of all of the deaths were reported last weekend. We're seeing a dramatic spike in the number of cases that have been reported and infections. And this was based off the data we had last week, one of the cities with the highest infection rates across our Commonwealth. That new data about rates of infection should be coming out tomorrow. But without question, a critical circumstance in Brockton and in our communities, and one that needs direct and dire attention of our state and federal officials. So we're thrilled to be joined by three great public servants here. City Councilor Rita Mendez, and we kick it to her to walk us through what's happening and why and how and what we need to do to address it. Maria Tavares as well is here. She's an activist who's been working to help older residents and those experiencing food insecurity as a result of the impact of the virus. And Lucy Marquez, who is a mental health counselor at Brockton and Neighborhood Clinic. We talked about the impact that this virus is having on folks suffering with mental behavioral challenges and their loved ones and families, and how we can try to support them. So we're thrilled to have Lucy here. But Councilor Mendez, why don't we kick it off with you? Just walk us through what you're seeing, why and what you need in order to get the assistance that your community so desperately is calling for.
Yes, thank you so much for having me here today, Joe, to speak regarding this very important issue. And every day when we get updates from the mayor, my heart already goes out, because I know it's going to be more bad and bad news each day and each moment. So just today, I heard there's additional 27 people who already got infected by the coronavirus. So as the days goes by, you think it's going to get better. It just keeps on aggravating, and more people just keep on getting infected, and it just keeps on spreading like a wildfire here in Brockton. It is just nonstop. The reasons for that, there could be several. I think it's probably because of the community. Socially, we probably not taking it as seriously as enough, because in Brockton there's a lot of multicultural people, and they like the social gatherings. So when you have the stay-at-home order, they like to do the small social parties gathering and have friends coming over, and because they don't have any symptoms, they don't think that they're doing anything wrong. They're just the normal. Or if there's anybody sick in the family, they're culturally tells them they gotta go visit to those who are sick, and then that person ends up getting even more ill and ends up dying. But not anything bad intentionally. It's just how the cultural is, and that's what we need to bring awareness. Tell people this is serious. You need to protect yourself. You need to wear gloves. You need to use your masks, protected devices, and all the times, every time when you're going out in public. And I think that's not even happening enough in the city of Brockton. And the mayor, he had to put on a curfew with people at 9 o'clock at night. They can't even go out on the streets until 6 o'clock in the morning, to try to see if that's going to get a little bit more controlled. I don't know what we'll take, but we definitely need to bring awareness. We definitely need to reach out to these people, these communities, and let them know this is serious and it's spreading, and it's very concerning.
Councilor, when did the curfew go in place? When was that ordered?
That just started on Friday. So as of Friday, which was the 17th, the curfew went in place. So the mayor stated that everybody going out in public must wear masks at all time. They cannot be out on the streets starting at 9 o'clock at night until 6 o'clock in the morning. And just really protecting themselves. No small social gatherings, no parties, nothing like that. So that just started on Friday.
And are you still seeing, you mentioned the kind of the more or less private gatherings, but cultural gatherings, people coming together. Are you still seeing that today, or are people getting that message?
The police officers, they still having to separate, you know, soccer games. People even playing soccer. Yeah. So unfortunately, it's still giving the police officers work because they have to be going out and actively seeing these people still in small social gatherings, and they have to disperse them. So it's still happening.
So what can we do to try to get that word out so people understand what this is, that this is a very serious circumstance?
I think there's a stigma too. People, maybe even if they are having some symptoms, they don't want to go to the hospitals and get tested, because then they're like, it's like stigmatized. Oh, you got the coronavirus, so we have to be isolated. You can't come near people. So I don't think they want to even to get tested because they don't want to know, because it's culturally, it's some stigma that I also feel, and also the isolation. We're not people that would like to be isolated. So
Right.
culturally, it's very hard for people to grasp that, especially when you've used with being around other people's all your life, and now you're being told that you can't have friends come over. We're just getting out the messages and everything that's happening in Brockton. I think we need to broadcast this in multiple languages and letting people know, and just being very firm that it has consequences. People are dying. It's very serious.
So with that, I want to turn it to Lucy. Lucy's, as I said, a mental behavioral health practitioner at Brockton Neighborhood Clinic. As we've talked about a bit, the impact of this virus is having a devastating consequence on folks suffering with mental behavioral illness and mental behavioral challenges. What are you seeing in the community in Brockton for people being able to still get those services, for people in need of services, and just for the greater community at large?
So I also want to thank you for having me here. It's a pleasure. Yes, I agree with Rita. Of course, it's huge impact, and I think it's all the way because of the stigma and the culture. That's for sure. And what we're doing right now at the Brockton Neighborhood Health Center, we are doing the telehealth. It's working so well. So we do have interpreters. So we're trying to bring knowledge to our patients, because yes, Rita is right. People, they are not understanding how important it is to follow the rules. So people are dying, and this is serious. So for example, I have patients that they share with me, they are positive, but unfortunately they can stay home because they have to work, and they go to work, and without nobody knowing that they have the virus. Or if they do not accept, they don't want to be labeled as a positive, and they just keep going to the grocery shop, they just keep doing these social gatherings. So it's really hard so they don't go just to check the general health. Can you imagine if they, you know what I mean, like go to make sure that they have a virus that they can actually get really sick from it? So it's really hard. But the telehealth it's working well, and definitely we needed to get prepared for the coming up weeks, because definitely we needed to the amount of cases will increase. People are really, really extremely anxious. They're so anxious about it, like especially for the immigration population. That's what we have the most in Brockton. Especially, I would say between 70 to 80% of our patients, they are immigrants. So they are house cleaners. They work in restaurants it's closed right now. They don't have business at all, and they don't have the access. They don't have, there's so many barriers, like language, you know what I mean, like culture. Sometimes they don't want to ask for help. So there's a lot of things going on. So people are thinking it's the end of the world, right? They call me and they say, is that the end of the world? People are really anxious and severe. It's getting severe and severe. I'm really concerned. So we're getting ready to for this our low cases increase. But we need to get more options, like treatment options for grieving and anxiety. That's for sure, because people are also passing for grieving. It's a lot of loss.
Okay.
We lost our routine. We lost our social lives. We lost our jobs, financial stability. So yeah, there's a lot of things going on, but definitely the culture, I think, in Brockton and the stigma are definitely it's increasing, or getting, providers, health providers work, like it's getting hotter because of that.
Lucy, thank you. And Maria, walk us through what you're seeing as somebody that obviously is caring for a population that is already at risk because of their age, that there's a greater likelihood of pre-existing conditions, that comorbid conditions that can exacerbate the lethality of the virus. A working class community where additional resources might be strained, and food insecurity. So talk to us about what you're seeing there and what needs to be done.
Thank you for having me here. I'm very appreciated. Thank you, Rita, for inviting me again. Right now, actually, they already most covered about the way with the community right now. I'm just gonna go straight to the point. Basically, we've been dealing with a lot of elderly because we provided home care service, and then most our caregiver, they are sick. And then some of them, they're afraid to tell us they're sick. They still go to the patient, and then the patient got contaminated. And then the patient, even though some of them, they don't want to see caregiver because they're afraid many times they can get sick. We have a patient pass away last week, and we don't know exactly what happened. And he been contaminated. He went to the emergency. He gets passed right there. And then some of them will have a patient, even though they're not with the corona, they're sick, they're afraid to go to see their doctor because they think they're gonna get sick right there. We've been having so much issue with our clients, with our caregivers as well. And some of them are afraid to go to work because they don't want to get infected. And as well with the resource, we've been trying to get all the resource, talk to Jimmy Pereira Reader and Tina Cardozo. I'm trying to help them apply for food stamps as well. And then we have a lot of people has issue with the landlord because they can't pay the rent because with the financial situation. And then some of the people, they're so afraid to tell they're sick. For some reason they get embarrassed. I don't know exactly what happened. Even though they're infected, they still be involved. They still go to families, get more people infected. It's like we try our best to kind of educate it. I'm trying to looking for more resources to help, and we try to educate it. We try to bring things out there, in Portuguese, Spanish. We've been doing social media, Facebook, to try to see how can they do it. But it's still getting worse all the time.
And a tough reality to end on, where you still say it's getting worse all the time. So Rita, talk to me a little bit about what you need, what additional state and federal resources need to come in to try to, one, make sure people can stay healthy, but two, to the extent that part of this is just being driven by community members that haven't quite recognized how dangerous the virus is. And this is something that is not particular to Brockton. It's one of the big challenges with this virus is you can be asymptomatic potentially forever, or asymptomatic for a long period of time, and infect a whole bunch of other people, and you don't even know until after others get sick. So what else can we do? What needs to be done so that people can understand just how critical the circumstances are?
Yes, and speaking of that, like Lucy said, and also Maria, without the big immigration population that we have, the immigrant community in Brockton, and to make things worse, the public charge, the federal, government just made it much harder for people if they have cases pending in order to get their green card. So it's saying if you got these benefits from the government, then you're not going to be eligible, to get your green card. So people are just even more concerned about that. So they don't even want to go get help because they're afraid.
And let's be clear about that, which I think the administration, and I disagree with everything they've done on immigration, included the announcement that the president made last night, which is just despicable. But the administration has given guidance that when it comes to testing and treatment and services with regards to COVID-19, public charge does not apply, right? Public charge, you're not going to be impacted in any way from any sort of immigration status for public charge is not going to apply here. So we got to get that information out, but that's the case.
Yeah, and thank you for saying that, because that is the concern, and that's what I have to keep explaining to people over and over again. If you have the symptoms, if you are sick, just do not go out. And like Lucy said, that a lot of times they are infected, they have the disease, but they're not as sick. So they stay home for a couple of days, but then they have to go to work because they are the ones who have to feed the families and make sure that they put food on their table. So they go quietly, not letting other people know, but then just spreading all over. So it's really bringing that awareness and letting people know that there is help, like Maria is doing, just helping them with the food pantry and making sure they have places where they can at least put the basic needs on their table. And it's just really helping us financially in that regards, making sure that, and also if they live in very populated homes. So if one person gets sick in that home, how is that person is going to quarantine himself to go to a separate place and not making sure that everybody else in the house is also infected, or maybe everybody else in that building, like maybe the triple deckers. So it's a lot of these types of homes in Brockton as well. So maybe it just spreads around there and it just keeps on growing. It's needs a place to at least quarantine people. Where can they go if they are they live in a home with lots of children and very populated? They live in many numbers.
And Rita and Lucy, you touched on this a bit too. So some of the factors there that we are seeing that I think plays into the challenge you're seeing in Brockton. There's some of the same factors you see in Lawrence, in Revere, and in Chelsea, right? Which again, the data from the states delayed, but the cities with the highest, the communities with the highest infection rates in Massachusetts. And as of last week anyway, Chelsea's was higher than New York City. And far higher than any other city in the state. They share some of the characteristics: immigrant population, densely populated, multi-generational households living under one roof, lack of lower income, right? A need for mass transit, but somewhat strained mass transit options. So the 111 bus from Chelsea is packed. Right? You get more people crammed into smaller spaces, that virus spreads. Multi-generational households, kids largely asymptomatic, take it back, grandma and grandpa gets infected. And obviously a higher percentage of workers who are essential, who are doing the jobs that the rest of our society needs them to do so that we stay functional, but essentially takes advantage of their labor and puts them at risk while some of the rest of us can in fact abide by those shelter-in-place orders, still work from home, but can go out and make sure that there's food, pick up food at the grocery store because somebody else has been out stocking those shelves. And when you look at those communities, Chelsea, Brockton, Lawrence, and others, that's who lives there. It's folks that power our Commonwealth, power our economy, power our state. And we're able to survive off of their work, but it's being done at grave risk to themselves and their families. So I'll wrap up here, but if there's one thing that you would suggest from our federal and state government that we do, I want to get that from each of you. And Lucy, why don't we start with you? We'll go to Lucy and then Maria, and I'll give you the final word here. So Lucy, one suggestion.
I think definitely we needed to have more investment to the mental health. Definitely for sure. It's something especially in Brockton, which like as we said already, it's so hard to bring knowledge to the population that it's so important to keep their mental health. So if we get more programs that, just education programs, psychoeducation program, promote more telehealth, because there is so many stigma that sometimes they don't want to go to the clinic. Just to let you know, I work at the 5th floor, and sometimes they go to the 4th floor and they use the stairs, so that way they don't press the button on the 5th floor in order for people in the elevator to know that they're going to see a mental health provider. So it's really serious. So I think that's all we can. We need to have more education about how important it is to keep, the mental health and mental health programs. We need more options for treatments. We do. We need other, like other ways to reach the community, especially the elderly people, especially, people with different, especially with this population. Like, we work with very different backgrounds, people. They don't understand that they pass so much in that country. It's a lot of trauma. It's a lot of things that they already passed, that they don't think that it's a simple virus that it's gonna kill them, and they don't believe that they can spread that to other persons. So it definitely, it's something more support that we need.
Lucy, thank you. Maria, one thing that we could do, one thing that you suggest.
Actually, I'm suggesting, we need to have resources in place. We need to tell everybody, if you're sick, don't feel shame to say you're sick. It's something that's why we're here. We try to help. If you can't go to work, we can find some resource for you to stay home and to stay safe and to protect you and your family. Because most our culture, we live 9 people, 10 people inside one house. And then don't be afraid to tell, don't be afraid to go to the hospital, because a lot of people is afraid, because if they go, everybody's gonna know they're sick. They don't want nobody to know they're sick. And then this is the most issue we find, the spray people go around all over the place.
Okay, and Rita.
Yeah, so we definitely need more funding to help us be able to provide to low-income families. So that way they're not waking up every day, okay, so I have to stay at home, but who's going to put food in my family's table? Who's going to provide? Because I'm the breadwinner of this house. So I think that's a lot of concern and a lot of pride there. So if we had definitely more funding in order to provide for these people, it would have been, fantastic.
Counselor, thank you so much for your leadership and for all that you're doing to try to care for folks in your community that I know are obviously in desperate and dire need. Lucy, thank you for what you're doing for a population that has experienced systemic underinvestment for far too long. It's been a big priority of mine in Washington. And hopefully one of the reforms that will stick coming out of this pandemic is the innovations around telehealth, which have been I think critically important for mental behavioral health community. And Maria, thank you so much for all that you're doing, again, for a community that is at risk on multiple levels, from an elderly community to food insecurity. Statistics have indicated that the percentage of families that are food insecure in our Commonwealth has doubled in the past 2 weeks, from about 19% to nearly 40%. And it's going to be something we're going to be struggling with for a long time. So thank you so very much for all that you're doing there. Keep in touch. Let us know how we can help, and stay healthy, stay safe.
Joe, can I just add one thing that is very important, and I think people are not paying attention. We are so into also to the food, to the financial resources, but let me tell you, I think at least I'll just say I think the average was about 50%, but I think we already in our area, we already reached 30% of domestic violence and child abuse during this quarantine. So I also work with kids. I work with Portuguese speak Spanish people speaks and English speaking population. So, and this is serious. Like, it's not just that financial piece that needs to be covered in the program and the resources, but also we cannot forget, these two serious concerns that we have is the domestic violence and the child abuse during this quarantine, because the kids is usually it's at school, or if the husband it's working, everybody's at home right now.
Right. The reports of child abuse have gone down dramatically, and that's not a good thing, right? There's been some reporting on this. Boston Globe did a piece a couple of weeks ago. We've tried to make this increase awareness on this as well, and it gets back to a number of the issues here that you all talked about the increasing awareness of the immediate impacts of this virus, but then the secondary and tertiary consequences of it too. So We'll do our best to keep our voices up on this. Thank you all for joining us, and stay healthy, stay safe.
Thank you.